Hello, fellow lung nerds. It's Rob Sims from Novus Medical, and this is the HiOx mask. The HiOx mask used to be known as the HiOx 80 mask. The valving in the front used to be in a Y shape, and in 2012, the mask was redesigned to its current configuration. It used to be called the HiOx 80 mask because we could deliver 80% oxygen at the alveolar level at 8 liters per minute. So typical non-rebreathing masks, to deliver higher levels of oxygen, you are setting your flow meter to flush. Not only is it noisy, but it's also very ineffective. And the reason for that is because of the holes on the side of a normal non-rebreather. And you can see the HiOx mask has no holes on the sides of the mask. Now, in a normal non-rebreather, the reason for those holes is so that if your reservoir bag collapses, the patient can still take a breath in of room air. Kind of an anti-suffocation kind of thing. The result of that, though, is that every inspiration that the patient takes, even when they're drawing 100% oxygen from this reservoir mask, all of it is being diluted by the holes on the side with room air. So you're delivering lower amounts of oxygen. It's really about 45%. The HiOx mask, again, doesn't have these holes. So if the reservoir were to collapse, where do they get their breath from? Well, it comes from this one-way valve right here. So this area is called the sequential dilution valves, and it's really the secret, the patented part of the HiOx mask. And it really is the key to this product. So during the exhalation phase of the patient, oxygen is going to be coming in through the nipple here, putting pressure on this one-way valve and closing it, and the gas fills up the reservoir bag. That reservoir bag is 750 mils. And during the inspiratory phase, the patient is now going to first draw 100% oxygen from that reservoir bag into their lungs, into the gas exchange area of the lungs. And should they need more than 750 mils, any extra gas now is going to come in through this dilution valve right here. And it's going to dilute the 100% oxygen coming from your flow meter, mix together and go to the patient. Now that's gas that's going to be in the end inspiratory component of the breath. And most of that is not going to be areas of the lung that are not taking part in gas exchange. So it really doesn't matter what the FiO2 of that gas is, because it's not taking part in gas exchange. So when the patient then exhales out, the gas comes out through this one-way valve and out and down through this port. This is a standard 22 millimeter port, and we can add a standard respiratory filter to it. I'm using today a PAL filter, commonly found with anesthetic gas machines and respiratory therapy equipment and ventilators. And this PAL is a HEPA filter with low resistance. The lower the resistance on this filter, the better. And now I'm able to filter out the exhaled gas. If I take a look at the mask at the back here, you'll notice that unlike a standard non-rebreathing mask, I have 2 sets of straps. One goes low, one goes high, and they're designed to be tightened down. There's some padding in the nose area here. Okay, so then now you can crimp it around the nose for a nice tight seal. And then this vinyl component of the mask, when you're wearing a mask, you get a little bit of condensation, a little bit of moisture under there. It actually kind of sticks to the skin a little bit. So now you have a pretty nice seal. And any aerosols that are produced by the patient are now going to be filtered out. This is why the Ministry of Health and Long-Term Care recommended this mask to be used to deliver oxygen in the 2004 SARS directives. We can also deliver an aerosolized drug by adding this nebulizer adapter, and it would just turn on just like that. And what it does is it allows now for a nebulizer to be connected here, and we can aerosolize drugs to the patient and not have to worry about the aerosol going out into the room. As the patient exhales out, it's going to be filtered through that filter. The HiOx mask is also considered an oxygen conserving mask because we're able to deliver higher amounts of oxygen at lower flow rates. So it would be good for transports, internal and external, because essentially your gas tank will last longer because you're going to be delivering a lower flow rate to get the same amount of oxygen to the patient. Home care would be a great idea as well. If a patient was on a concentrator, maximum 4 liters per minute, nasal prongs, and they needed more oxygen, the HiOx might be a great way of delivering that additional oxygen to the patient at that 4 liters per minute. Of course, you can always use higher flow rates than 8 liters per minute. You can, if the patient has a higher minute volume, you can increase that flow rate for sure. The HiOx mask can also be used to deliver Heliox. One of the biggest issues with Heliox delivery is that you're using a non-rebreather mask, again, with the holes at the side, which again are going to dilute that Heliox every single breath right from the beginning of inspiration to the end. With the HiOx mask, the Heliox is not diluted until the very end of the breath, but the initial part of the inspiratory component of the breath is going to be close to 100% of that Heliox mixture. If you have any questions about the Heliox mask, please visit Novus Medical at www.novusmedical.ca. Go to the contact page and fill it out, and we will get back to you as soon as possible. Thank you very much for watching.